obtaining information on patients is necessary before management can be planned out. Therefore, we obtain information by clinical interview, by clinical examination, as well as supplement these with investigations that are planned out relevant to the clinical presentation. In a pregnant woman during antenatal care, it is very necessary that we examine the mother to obtain the details of the baby, its growth, its lie and presentation, and the presence or absence of the fetal heart sounds. So therefore, our demonstration would be for the purpose of enlightening you on the various components of the abdominal examination of a pregnant mother.
In the first instance, I will explain to the patient what is going to be done. අම්මේ අපි බලාපොරොත්තු වෙන්නේ ඔයාගේ උදරය පරීක්ෂා කරලා ඔයාගේ දරුවා පිහිටලා තියෙන විදිහයි ඒ ඉන්න අනිත් විස්තර ලබා ගන්නයි. ඉතින් ඔක්කොටම ඉස්සෙල්ලා ඔයා මේ අදේ හාන්සු වෙලා ඊට පස්සේ අපි සකස් කරගන්නම් ඔයාව මේ පරීක්ෂණය කරන්න. In the first instance, the examination of the abdomen of a pregnant woman follows the same general principles of abdominal examination, which is an inspection followed by palpation and then auscultation. Firstly, the patient is positioned properly, and you can see here she is in the recumbent position, and her arms are placed in a way that is comfortable for her. And then we need to expose the abdomen so that we can proceed with the examination. මේ පොඩ්ඩක් අපිට සකස් කරනවද මේ අම්මව? Now, as you can see here, the abdomen is exposed. The first thing that we observe on inspection, as you can see here, very clearly we can see the linea nigra, which is this dark pigmented area. And in addition to that, you can see that the umbilicus is also flat, but that is not of any clinical significance at this moment of time. In addition to that, we can see a lot of striae which are very prominent in the case of a primigravid mother. Following that, if it is a multigravid woman who has had previous operations, or if she has had any other kind of operations in the past, the scars need to be examined and also the details noted. And these are the main items that we note on inspection. I will then proceed to the palpation of the abdomen. In this instance, we have to remember that we are basically following the same principles of examining an abdominal mass, which is we like to define the margins first. The enlarged uterus is like an abdominal mass, and the uterus has grown from the pelvis towards the xiphisternum. So therefore, we need to define what the fundus of the uterus is first of all. And to do that, I will examine to see where the xiphisternum is first, from the xiphisternum, I would position my hands as shown here and palpate right up to the margin of the top of the uterus. Now, it is not only in the midline that we need to examine the mother's fundus, but we should also palpate on both sides, to the left and to the right, with the purpose of looking at the shape of the fundus as well as noting the highest point on the fundus. And using a tape, we measure the symphysiofundal height. The measurement is made from the highest point to the top of the symphysis pubis. This is how the tape is held, and as you can see, with the fingers holding the tape in this manner, and once the top of the fundus has been identified, we fix the end of the tape there, and using the thumb to palpate the top of the symphysis pubis, we go down until the symphysis pubis can be identified, and that measure is noted in centimeters. This is 37 centimeters in this particular lady. From there, I would proceed now to examine the lower pole, where again the same principles of feeling an abdominal mass would be adopted. And in this instance, it is the lateral margins of this mass that should be palpated. And how do we do that? We need to place the hands in such a manner that it is at equal distances from the midline as well as the furthest away from the midline. So, the easiest way of doing it is to position the hands with all the fingers together like this, and position it in such a way that the little finger touches the anterior superior iliac spine. Now, you can see that I am palpating, both my hands are parallel, the surfaces are parallel to each other. Then I will get the mother to breathe in and out so that she is relaxed. And when she breathes out, we press the fingers in and sustain it until such time the lateral margins of the fetal head or the presenting pole are palpated. I am now feeling the presenting part, which is the head, and then gently moving towards the pelvic cavity and moving upwards, I can note the exact shape of the presenting part, which is the head in this instance, and also I would then move further down so that I can now identify the widest diameter of the fetal head if it is not engaged. If it is engaged, the widest diameter of the head would be within the pelvic cavity. Please note that my fingers are still parallel to each other and they do not come anteriorly in front of the presenting part. This is the wrong way of examining the lower pole, and therefore I would like to reiterate that the fingers have got to be, or the hands have got to be, parallel to each other and palpate in the lateral surface of the lower pole. From this position, the next item is to examine the upper pole, and it is very easy. If the left hand is shifted up and the upper pole is felt, and if the lower pole has been occupied by the fetal head, the upper pole will obviously be occupied by the breech of the fetus, and therefore I have now positioned the baby, I have now really steadied the baby in such a manner that I can proceed to feel the trunk, and that I do with my right hand, where at equal distances from the midline with the patient's breathing movement, I will palpate the two sides like that, and I can feel the fetal back on the left side over here, and it is quite lateral to the midline. On the right side, I feel the gap here with the fetal limbs, which can be felt relatively easily. So once I have defined the fetal back, I can even feel it towards the superior end of the feet of the mother as well as the inferior end, so that the whole back can be traced. And the next item, while the fetus is being held in this manner, I will listen to the fetal heart sounds. I will use the Pinard stethoscope, and generally if it is a fetus that is in an occipito anterior position, you can surface mark the point at which the fetal stethoscope should be positioned by taking 1/3 distance of a line from the umbilicus to the anterior superior iliac spine. And I'll place it exactly there, and please note that I have not released my hand, my left hand, and the fetal stethoscope is held with my right hand, and then I will listen to the fetal heartbeat, and while doing so I am always holding on to the fetal stethoscope. It is unacceptable to let go of the fetal stethoscope, that you press it with your head onto the patient's abdomen. Now once that has been done, I have also made an observation about the quantity of liquor. There is no necessity to make a separate examination for this purpose. But before making the final examination of the quantity of liquor and then coming to conclusions, we'll also need to look at examine to assess the size of this baby. And what we really would do is look at the extreme end of the fetal head and the extreme end of the fetal pole, upper pole, and that you can see the whole fetus is between my two hands, and a rough assessment of this fetal size can be obtained. And with this observation, I can say that this baby is probably about 2.8 kilograms, and therefore it is acceptable for this period of gestation. And finally, of course, since we have made all the necessary observations that we need to then therefore make the mother more comfortable and explain to her what the findings are. Amme, we examined your abdomen now and got all the details of your baby. The baby is positioned correctly, that is along the length of your abdomen, and the baby's head is facing the birth canal, and therefore we feel, since the growth is also satisfactory, we feel that everything has progressed satisfactorily in this pregnancy up to this duration. So we are confident, and we hope that the rest of the pregnancy also will proceed well and you will have a healthy baby. Thank you very much for the assistance you have given us to prepare this training video, which is for our medical students in the Colombo Medical Faculty. You have now seen the method of examination of a pregnant mother demonstrated to you using the basic principles of clinical examination. To reiterate, it involves the process of inspection, palpation, auscultation, and finally to draw conclusions from the data that has been obtained. It is now necessary that you practice the method of examination so that you become very familiar with it and you are confident that you would be able to use it in your clinical practice. You will no doubt
be exposed to different methods of examination during the course of your clinical training. Whichever methods you are exposed to, you should practice these methods and eventually develop your own preferred method of examining the pregnant mother. Data gathering and data presentation are two different things. It is not expected of you to just read out the data that you have collected during the process of examination of the mother. The data presentation should also include your conclusions from the data that you have collected. So, in this mother whom we have examined, we can say that Mrs. Pereira's abdominal examination has shown a baby who is at term, lying longitudinally in a cephalic presentation with the head not engaged, and the fetal heart sounds are satisfactory, and fetal growth is which is expected of the duration of pregnancy. Further, we could state that the fetus appears to be in a good condition because the fetal heart sounds were satisfactory, the fetal movements that the mother has felt were good, as well as the liquor content has been to be what is expected of that duration of pregnancy. So using this kind of information and the case presentation, you will be able to communicate with your colleagues, with your superiors during the course of clinical practice. I wish you the very best in your training so that you may gain the knowledge and the expertise to eventually serve the public of this country.